Hi, David. Welcome to our virtual meeting. I hear you have some questions about sexual health, HIV, and safe sex.
Yeah, I don't know much about it. I want to be safe, but I'm not sure where to start.
That's totally fine. It's fantastic you want to learn. Let's start with the basics. Do you know what HIV and AIDS are?
No, not really.
No worries. HIV stands for Human Immunodeficiency Virus. It affects your immune system, which helps fight off infections. If it's not treated, it can lead to AIDS. This is when the immune system gets really weak, making it hard for the body to fight off serious illnesses.
Oh, I didn't know that. So how do people get it?
Good question. HIV is mostly spread through having unprotected sex, sharing needles, from mother to baby during birth or breastfeeding, blood transfusions, but this is very rare now because of careful testing.
So kissing doesn't spread it?
Exactly. HIV isn't spread through kissing, hugging, sharing food, or just being close to someone. There are many myths about how it spreads, so it's important to know the facts.
How can someone tell if they have HIV?
Early on, the symptoms can feel like the flu, so testing is key. Some common signs would be fever, swollen lymph nodes, sore throat, rash, fatigue, and muscle aches. But some people may not show for many years. This is why routine testing is so important.
So someone can have HIV and not even know it?
Exactly. That's why regular testing is crucial, especially for those at higher risk.
What about AIDS? Do symptoms differ from other illnesses?
Yes, the symptoms of AIDS are usually more serious and can resemble those of other health issues, which makes it difficult to recognize without proper tests. Some common signs to look for are significant weight loss, ongoing fever, sweating a lot at night, long-lasting diarrhea, unexplained skin sores, and infections. That's why it's really important to get tested early. If HIV, the virus that can lead to AIDS, is caught early, it can be treated and might not progress to AIDS.
So how can I protect myself?
There are several ways to practice safe sex that can greatly lower your risk of HIV and other sexually transmitted infections, STIs, by using condoms and dental dams during sex. With condom use, always use condoms correctly every time you have sex. I can show you a quick demonstration. This would be my model, and this would be the condom you use. So you would just open it up, place it on top, make sure there's some space, and then just roll it down, just like that. Okay, and just remember, David, always to check the expiry date on your condom package before use to make sure it's not expired. Another option would be PrEP. This is a daily medication that prevents HIV or helps. It is especially useful for those at higher risk, like people with HIV positive partners. PEP is a medication taken soon after potential exposure to HIV, and it must be started within 72 hours to be effective. Regular testing. Keep track of your own and your partner's health status through routine testing. Limiting partners and communication. Talk openly about sexual health with your partners and try to limit the number of sexual partners.
So you mentioned PrEP earlier. How does that work?
PrEP is a daily pill that helps prevent HIV when taken correctly. It can reduce the risk of HIV from sex by about 99%.
That's really impressive. So can anyone take it?
PrEP is best for people at higher risk of HIV exposure. This would include those who have an HIV positive partner, have multiple sex partners, have sex without condoms, or share needles.
Are there any side effects?
Most people experience mild side effects, but it's important to talk to a healthcare professional before starting PrEP to understand any potential risks.
I heard you can get HIV from mosquitoes. Is that true?
Well, that's a common misunderstanding, but no, you cannot get HIV from mosquitoes. The virus only survives in the human body.
But what if two people who are HIV positive have sex? Can they both infect each other again?
That's a great question, David. Even though both partners have HIV, it's still a good idea to use protection. This helps prevent passing on different versions of the virus or strains that may be resistant to treatment.
So can you tell if someone have HIV just by looking at them?
No, you can't tell just by looking. Many people with HIV appear completely healthy. The only way to know for sure is to be tested.
Can HIV be cured?
Right now, there is no cure for HIV. However, with proper treatment, the virus can be managed to levels. This means that a person can live a healthy life and won't pass it on to others.
So how do people get tested for HIV?
Well, there are several ways to get tested. Rapid HIV tests. These give results in just 20 to 30 minutes using a small blood or cheek swab. Lab tests. These involve a blood test and take a few days to get the results. Home testing kits. You can also test yourself at home for privacy. But it's really important to get tested regularly, especially if you have multiple partners or engaged in activities that could put you at risk.
Wow, I've learned so much today.
I'm really happy to hear that, David. Understanding sexual health is crucial, and knowing how to protect yourself puts you in control of your choices. Would you like some resources or help finding a place to get tested?
Yes, that would be great. Thank you so much, Nurse Lisa.
It was my pleasure, David. Take care of yourself and stay safe out there.
Thank you. Bye.
Bye.